Hello everybody, it's Julia from Massage by Julia, and today's video is post-cosmetic surgery exercises. Now your doctor probably told you that starting day 1, day 2, you've got to get up and start walking, and that is really good advice. They probably explained that it's going to start revving up your healing process, speeding up your healing, and also it's going to prevent you from getting blood clots. So it's really important that you walk, even if you get up, walk very slowly down the hall of your home or apartment, and then come back. Try to walk further every day. It's not going to be easy at first, but there's also another reason I wanted to tell you why walking is so important and why you hear that advice all the time. The lymphatic system, and we're trying to move our lymphatic fluid, right? Because that's going to decrease your swelling. It's going to speed up your healing, going to get rid of the pain and the bruising, prevent scar tissue from forming. So what they may not have explained to you is how in all of us, all the time, there is mostly the way that our lymph fluid moves in the body mostly is using our muscles, and it doesn't have to be a formal exercise class. It's just getting in and out of the car multiple times a day. We're driving, we're doing the dishes, we're bending over several times a day to pick up children or grocery bags, right? So just moving our bodies causes these muscle bundles. This fist is a muscle bundle, and when it expands and contracts, when we go about our day doing things, the muscles are knocking against neighboring lymphatic vessels, and the vessels are very, very tiny, but they're filled with lymphatic fluid. So when we use our muscles, when we're walking, the muscles are knocking against the vessels and stimulating them, waking them up, saying, hey, trickle your fluid up and away, do your thing. So all of the lymph in the body is going to come all the way from the feet and eventually comes up to these two veins at the throat. These veins deposit into the heart and lungs. The lymphatic fluid then mixes in with your circulatory system. It all goes through the body a second time, mixed in with that blood, eventually going through the kidneys, and then you urinate out the excess. So that's the drainage portion of lymphatic drainage. So like I said, any kind of muscle movement is going to start pulling the lymphatic fluid up to here, to the throat. And it's going to decrease swelling if you have too much in one place, and probably it's going to be in your abdominal area, right? Now, I have heard my clients say that doctors usually recommend that you start an exercise program or back exercising after about 4 weeks. Some clients have said that their doctors are now recommending after 3 weeks. So whatever they say, follow that advice. But actually I want you to not think so much about, okay, now I get to exercise, I get to work out, I get to go back to doing something strenuous. I'd like you instead to think about doing movement and go in slow motion. It's slower than you might be used to, but your body has been through a trauma. That's what surgery is. It's healing from the inside out. It takes a long time, and I need you to be patient. So we're going to be moving very slowly, and just think about taking it slowly, doing easy movements 2-3 times a day, and every day will get better and better. You're going to be stronger and stronger and slimmer as the swelling goes down. Now, another very important thing you can do starting right after surgery is deep belly breathing, because again, as you're doing your deep breathing in and out, you're utilizing your abdominal muscles. Your diaphragm moves up and down as we take deep breaths. That muscle is pushing down on lymphatic vessels. So all the muscles, like I was saying before, these muscles are knocking against lymphatic vessels, and there are many important lymphatic vessels in the abdomen. And so when you do the deep belly breathing, that's going to flush the swelling that's caused by too much lymphatic fluid up to these two veins at the throat. And I made a YouTube video of myself on the massage table doing the deep belly breathing sequence. And where you can find that, where you can find all my videos, is you type in all lowercase Massage by Julia, and then all my videos will come up. The deep belly breathing video is called deep breathing to boost immune system and decrease swelling. So look for that one. It's also accessed off my website, massagebyjulia.com. And I'm looking at my cheat sheet. You'll probably be wearing a faja, a garment. What you can do for the deep belly breathing is undo the abdominal section of your faja, undo the clasps for 5 or 10 minutes a couple times a day. It's not going to ruin anything because you're going to be pushing your tummy out as you're doing this breathing and then sucking it back in. So it's going to be real hard wearing the faja. So you have my permission to undo it for a couple minutes and then do it back up again. And also, if you have not had breast surgery, I want you to follow the next set of movements that I'm about to show you. Ask your doctor if you have had something in the breast area, breast augmentation or explants. Make sure you have clearance from your doctor before doing any exercises, especially a lot of times they don't want you raising your arms up above your shoulder level, okay? So that's a little bit different category. But everybody else, what you can start doing other than the breathing exercise several times a day and the walking several times a day are movements like this. So let's say that you've had abdominal surgery, let's say you've had lipo on the back, right? Start with one hand, one arm, and very slowly, when you've gotten clearance to start exercising, move one arm up and down and just see how that feels. Because what this is doing, this is going to be stretching the skin at the side body and also stretching all the skin in the back. Okay, so if you've had some lipo, just doing this might be enough. Okay, so you might want to do 5 of these to start. Okay, and then the same with the other arm, very slowly. It might even be too much at first to do both at one time, all right? But you check your body and see what it feels like, okay? You might only start with 5, and then you can work up. As the weeks go on, you can work up to doing 10 and 20, okay? Start doing that. Something else that you can do is do really big arm circles, but slowly. See how slowly I'm doing these? You go all the way back. That stretches the pec area. You come all the way up. And notice now again, I'm stretching the side body and the back. Try to brush your ear as you swing your arm forward and down. Okay, this might be enough. Do a few of these. You know, you can do 5 in one direction, pause, then start and do maybe 5 in the other direction. And then you do the other arm, okay? Something else you can do is, I'll step to the side a little bit. You start standing up nice and tall, abs are in, and just see if you can raise your arm up and touch your ear and come down, okay? Just do one arm, abduction, which means bringing it away from the body, up and down. Now, at first, if you can only go this far, let's say, that's fine. Because you know that as you do slow movements every day, a couple times a day, 3 times a day, right, you'll get better and better. You know, the movement will be easier. Your incisions will be healing. They will be pulling on the surrounding skin, that kind of thing, okay? And then you want to do one of these. And then maybe in a couple weeks, you'll be able to do a few of these. Now, this really lifts up the skin in the back. I can feel it. So be careful with this. You might not be starting with this, all right? But it's nice and slow, mindful movement, very careful, okay? And what else did I write down? We can put our arms out at a T and cross in front and swing them back. Cross in front and swing them back, okay? Do a few of these. When you come forward, that's when you're going to feel most of the stretch in the back, right? Do a few of those, or similar movement, do a few of these, okay? Straight out, pull something back. Straight out, pull something back, all right? Try a few of those. And then I wrote down a list. This one's a little more advanced, but when you're ready, you can lift them both up. And then carefully, smoothly swing them back and come up forward. And then swing them back, okay? Try a few of those. The numbers don't matter. The number of reps, start with 5. You can move up to 7, and then you can do 10, and then you can try 15, okay? I want you to, instead of focusing so much on the number of reps, I want you to focus on having good posture, being mindful, being careful, doing just one side at a time if you have to, okay? It's all in slow motion because you're healing. Now, another couple stretches that I like to show my clients when they're ready is you stand with your feet hip width apart, nice and tall. You pull your abs in and your knees are bent. You see how I'm coming down a little bit? I'm bending my knees. And then it doesn't matter with this one where you put your hands. Let's say you can put them up here, put them down here. You're going to just twist and hold. And then very slowly twist the other way and hold. And you do these in front of the mirror and you can literally see your skin. There's a diagonal line going this way, and then when you stretch over here, there's a diagonal line going this way. That's good. You're slowly starting to stretch that tight skin. You're strengthening and stretching your muscles and your skin. And with all of these movements that I've shown you, you're bringing fresh oxygenated blood to the area, which flushes out what I call congestion. It gets rid of a lot of the pain. You get your movement back. You don't feel so tight and uncomfortable, okay? Pull your abs in the whole time. And then if you want, you can just hold it for a longer period and just let everything start to gently stretch open, okay? Another one I like to show my clients is same starting position. Your hips, your feet are hip distance apart. Your knees are slightly bent. And then you hold in your abs as you tilt to one side, and then you come up. And you tilt to the other side, and you come up. Okay? This is a little more challenging. If you can only start by doing 3 on each side, that's fine. It's not a competition. Hold your abs in the whole time. This is both a stretch move and a strength move. So let me show you why. As we are coming to the side, this is being stretched. All right? But then all of these muscles have to contract to pull your body, your upper body, back up to the upright position. So it's really nice to both stretch, and then you're going to strengthen this side. So this is going to really whittle your waist and have help you have a nice slender shape. So there you have it. Try these. You've got a list now of what you can do once you have clearance from your doctor to start movement, to start exercise. But I want to emphasize to you to do them slowly and mindfully, and then it'll really speed up your healing.